Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. Welcome here for those of you that are coming back again, and to those of you that are new, I'm glad to see some new faces, or at least names on my message board here. A word about how I want you to write questions to me. So for those of you that are new, you can write questions to me, and those of you that are coming back, you can write questions too. But I've changed how I want you to do that over the last few webinars, and that is, in the chat box area, you can see an icon that is a question mark icon. I want you to click on that first and then write your question after you clicked on that. If you're writing your questions without clicking on that question mark first, I probably won't answer them, to be honest with you, okay? I want these all to show up in the Q&A area by you clicking that question mark, all right? For those of you that are new, there's a couple ways you can participate here. One is to listen to the questions as I read them, and you'll be able to read them on your message board too if you're here in the live version as well. And then see what responses I give, and there's a lot of good learning that can take place that way. The other way is write a question, okay? And again, as I said, click on the question mark icon to do that, okay? All right. I am creating a recording of tonight's webinar. I should get that out to you tomorrow morning, somewhere around 9:30 in the morning is usually what I try to, sometimes earlier than that. I have to do a brief edit of the video tonight, and then I usually try to write a brief synopsis of what we talk about too, so people can follow it. That will come out to you tomorrow morning. In that email tomorrow morning, also, there'll be a chance to sign up for the next series of webinars, and those will be in April, actually. This is actually the last webinar for March. I'm going to actually be off for a couple weeks doing a webinar. One of those weeks, I'm going to be traveling out to see my 90-year-old dad in Colorado, so I won't be available to do it that week. Got to go check on him and his assisted living situation. Anyhow, that's what I'll be doing. So please sign up for that tomorrow morning. And then also, when I send out that email, I make one request of you all, and that is that you would also forward that email to anyone that you think might get benefit from these webinars, either in signing up and participating themselves or hearing what I have to say too. Okay. All right, so without any further ado, I'm going to go ahead and get started here. Oh, one last thing. So during the webinar, as I said earlier, I will be, if you're in the live version of this, you're going to be able to see the question. It shows up on your screen. They do not show up in the recorded version, though, unfortunately. Okay, all right. So let's go ahead and get started here. All right, first question is from Gail. Hi, Gail. Let's see here. Hi, Dr. Ross. My Lyme litter naturopathic doctor ordered a cytokine panel through LabCorp. My interleukin 12, 4, 10, and 13 were high. 13 was very high at 14.9. Interleukin 1 beta was very high, and tumor necrosis factor alpha was 8.9. Questions. Might these cytokines go down as I get further into treatment? Are they a good way to see if one is getting better? Okay, so I'm going to answer that question first. So everyone, whenever somebody has Lyme, the major symptoms that they have are actually triggered by the immune system making and manufacturing a group of chemicals called cytokines, okay? And cytokines are good and bad. So when white blood cells see an infection, or if they see a mold toxin in you, they want to try to get rid of these things. And they manufacture a bunch of chemical messengers called cytokines, which are inflammatory chemicals. On the good side, what cytokines do is they cause your immune system to make more white blood cells to fight infections. They draw those white blood cells to where the infection is, and they help those white blood cells work better. Okay, so cytokines are good. They're good things, okay? However, if they get made in excess, they're not good things. And the problem is in Lyme and in mold toxicity illness and in other chronic infectious states, the immune system keeps trying harder and harder, even if it may not be doing a good job, and eventually it makes too many cytokines. Too many cytokines give you most of what we call Lyme symptoms, and give you most of what we call mold toxicity symptoms, and that's why these two areas look very similar to each other. So too many cytokines make it so you can't think, disturb your sleep, make you hurt all over, give you bad fatigue, interfere with how your hormonal systems work. suppress your immune system. Okay, so basically what's going on in Lyme disease is too many cytokines. All right. Now there are a group of cytokines that we can measure. The trouble is they're probably not, my experience, and Gail, this goes to the heart of your question, I don't find them to be accurate indicators of what's happening with the person. So I've had people with Lyme that we've done the testing for these specific type of cytokines, and there's other kinds of cytokines too, okay? And they'll come back normal. So it has me questioning the accuracy of these panels, especially when it comes to Lyme. Now, is it possible as you start getting treated that they're going to get better? Yeah, it's possible. But as far as a tool of tracking how somebody is doing in Lyme disease, they haven't been validated to be relevant, okay? And as I said too, I just don't find they reliably indicate what's going on with the person, because even though there are cytokines, I don't think they always show up in these tests. For whatever reason, I don't know why, but I had people that have obvious inflammation from the infections and we get back normal cytokine panels. So I don't use them, basically, okay? All right, and so I don't think they're a reliable way of telling if you're getting better. And no one's validated that as a way of telling for sure, okay? All right, number 2, I'm not vaccinated and haven't had COVID because I have SIP for 2 years. The isolation is awful with cytokines like this, and I also have a positive ANA. Am I at higher risk for an adverse vaccine reaction? I know getting COVID would be awful. All right, so in my experience is that no, you are not at any increased risk with the kind of conditions you've just stated at having an adverse reaction. All right. Let me rephrase that. So for having Lyme itself and having elevated cytokines does not put you at any increased risk of an adverse outcome. There have been some studies done about vaccination in general, not about getting the COVID vaccine, but about getting any kind of vaccine in general, like a pneumonia vaccine, pertussis vaccine, and DPT vaccines, any of the vaccines. And when you have an autoimmune illness, and the ANA would suggest you have some autoimmune component, there is for all vaccines, there is a slight increased chance of getting an adverse outcome, but it's minuscule. It's a minuscule difference, okay? So in general, when I have patients in a similar situation as what you are, because of the adverse outcome of getting COVID and the harm from getting COVID, I think is much greater chance of harm to you than the harm that an average person or that a person with Lyme and with the positive ANAs you're having would have from getting the vaccines. I still recommend the vaccines. Now, I am not your doctor, okay? So, and any advice that I'm giving you here, you should talk with your doctor who knows your health better than I do, okay? But in general, from what you've laid out here, I do not look at this as any reason to suggest you're going to have a greater chance of an adverse outcome, okay? All right. Number 3, let's see. Also, for hormone replacement therapy for perimenopause, for severe insomnia and night sweats secondary to hormones, what types of HRT do you use? If I still get periods here and there, I'm almost 55, is it bad to use them daily? My Lyme literate naturopathic doctor prescribed, basically it's an estrogen mix, okay, with different kinds of estrogen, and VersaPro progesterone. Can I use these both daily if I'm skipping months, etc.? All right, so about the hormone replacement therapy. So my approach when I've got somebody that's is perimenopausal or menopausal and having disturbance of sleep from that is there's a few things you can do. Number 1, you could try antidepressant medicines in the SSRI family. That would be things like Paxil, Prozac, I'm blanking, but the SSRI family, okay? Gosh, I'm not sure why I'm blanking in the full of those, but I am, all right? So those can help sometimes with sleep and the hot flashes. If that's not something you want to do, then my next step usually is to use progesterone only initially. And often just using progesterone is enough to help. And if that doesn't work, then sometimes on a short-term basis, meaning for a year or so, I might use estrogen as well too, coupled with progesterone. Okay, so that's kind of what my approach is. All right. And then finally, you have a last part to your question. Let's see. Also, are there, and I see where your last part is here. Are there any sleep medications that are prescription that are not drying? Okay. So there are a variety of medicines that can be used for sleep. There are some that are classified as sleep medicines, and there are some that induce sleep as a side effect. Okay, so the ones that induce sleep as side effects would be the ones that fall into the antidepressant medicine family, like something called trazodone, or could be things that are in the anti-seizure families, like gabapentin or gabapentin. All of those would be drying. Okay, so I wouldn't do those. Of the sleep medications, I believe, let me look one up here real quick, just a minute. Generally, the ones that are truly classified as sleep, which would be which are ones that are short acting, like Ambien, for instance, and Lunesta would be another one. Generally, I don't think that those are drying, but I'm looking those up real quick here. Just bear with me a minute. So, when I've tried Ambien before, and I have not seen people have the dryness from it. That might be something to consider trying. Okay, all right. Good luck to you, Gail. Hello, Rich. Let's see. These webinars have been incredibly helpful to me, so thank you for doing them. You're welcome. I'm glad to hear you're getting some benefit from it too. Let's see. I have heard that Lyme can attack the collagen structures of your body, and some people recommend taking collagen supplements for this reason. Do you recommend that your Lyme patients take a collagen supplement? I have heard there are different types of collagens, type 1, 2, 3, etc. What type of collagen would be best? Is there a specific collagen supplement that you would recommend? It is true that, so one of the things that can happen with the Lyme infection, not Bartonella, not Babesia, not the co-infections, but the Lyme infection, is that Lyme likes to live, likes to survive, all right? And one of its defenses that it uses is it likes to bury itself deep into tissues where there isn't good blood flow. And those tissues tend to be what are called connective tissues. And connective tissues in our body are things that like give your skin structure, that are around your muscles and your joints. Those are connective tissues. And the predominant protein that that is a part of the structure is collagen. Okay, all right. So they release. So what Lyme can do is make enzymes that destroy collagen. All right. So it is possible that people start getting into problems with collagen destruction. It's not a very big thing, in my opinion, though. Where you tend to see it a lot is in skin structures. You'll start to see that people tend to get more wrinkly. They tend to have more sagging because collagen is one of the supports for your skin and your tissues, basically. All right. So if I am having a person that is concerned about what is happening with their skin, for instance, that tends to be the main reason I would do it. I might look at having them take collagen peptides. Proteins are made up of amino acids. Long strands of amino acids would be 30 amino acids or more. We call that a protein. Okay. If you have amino acids that are less than 30, that's called a peptide. All right. And peptides, if you were to have long strands of collagen, some of that might get broken down. But if you have peptides, the whole peptide might get absorbed and therefore can be used as a building block to build all kinds of collagen. All right. And so the product that I like for that is something that also has a number of other things in it that can actually support skin, is a product by Thorne called Collagen Plus. And that Collagen Plus has in it collagen peptides. And in addition, it has peach extract in it that also is rich in something called ceramides. And ceramides are a type of like oil type layer that covers our skin to lock moisture in. And if you give more ceramides, you're going to get more of that kind of structure over your skin to help hold water in the skin to give it more structure as well too. So I'm tending to use it more for skin support than I am necessarily using it to help other collagen tissues in the body. But whatever you're doing to help collagen in the skin is going to help your other collagen tissues as well too. All right. So I can show you what that product is. Let me just do a quick screen share here. All right, so this is my supplement store, and for the collagen peptide product, it's this Thorne product called Collagen Plus. Okay, all right. And then for those of you that might be interested, I have launched an area of my site called Skin and Beauty. And this is being redesigned. It's a little bit too wordy right now, but I'm having this design so it looks better. In about another week or two, there will be a new design to this page. But I talk about why it is that you might want to consider doing some skincare products. And I talk to you about some ways that you might use them here. But down here is where my skincare line is, okay? And that Collagen Plus is down here. The other products that I have here, I talk about them in the description. They are made by a company called Passport Organics. And as much as possible, they're organic and natural so that you're not putting more poisons on you, which is not a good idea if you have Lyme. So anyhow, for those of you that are interested in seeing what products I carry, you can take a look at this section here. And again, I'm cleaning up what this looks like. I don't like the way this is presenting here, but in about another week or two, we'll have a new design to this section. But you can see all of the products down here. Okay. All right. All right, Rich, good luck to you. Hello, Jim. Hi, Dr. Ross. Thanks for these great webinars. You're welcome. Let's see. I've had a problem with blood on the toilet tissue that's been happening usually a few times a year for the past 25 years. This will happen if I strain the least bit at stool or if the stool is very hard. It seems that maybe something is getting scratched or cut a bit. I realize I should get a colonoscopy, but my question is there anything I can do to help stop this? Taking extra magnesium or vitamin C helps by softening the stool. Any other thoughts on what might help? Can anything be done to strengthen the gut lining or something else that might be getting torn a bit? Okay, so Jim, so first of all, as you know, if you're over age 50, and I don't know if you are, but if you are over age 50, make sure you're getting your screening test done. And there's different ways to do it, but screening for colon cancer. Okay. I don't believe this is colon cancer, but I want to say that to you. Okay. And it can be either you can do stool studies that you can be done. You can do colonoscopy. You can do what are called hemocult cards, but talk to your primary care doctor about the steps you should, especially if you're over 50, what you should be doing to screen for colon cancer. Okay. Now, do I think this is colon cancer? Probably not. Okay. So what happens is in the anal opening, there's a lot of veins in that area. And if those veins get overly stretched out or enlarged, they show up as hemorrhoids. Okay, so you've got some hemorrhoids that can sometimes show up on the outside. You also have some hemorrhoids that can show up on the inside of the anal opening as well too. All right. What makes those blood vessels actually stand up a little bit more and potentially get scraped and bleed is if you start getting constipated. And so what the issue is the veins that The way that blood flow goes is the veins that are in your leg, the flow of those veins goes up towards the anal opening, and then it goes around the anal opening, and then the veins, the flow of blood travels up along the inside lining of your intestinal tract, along the colon, and eventually goes back up to your heart, okay? If you start getting a lot of constipation, that's going to lead to pressure against the blood vessels and the lining of your intestines. It's going to push against those blood vessels, which is going to block blood flow. So you start getting more blood pooling in the veins on the inside of your anal opening and on the outside of your anal opening, which can lead to swelling in those veins and making them very easy to tear when you have bowel movement, okay? So that may be what's happening to you. All right. Now, granted, the only way I'd really know is to be able to examine you. Again, this is something you should talk to your doctors about too. Okay. But if this is due to constipation causing some dilation of your veins, or that's what I'm describing here, then what you want to do is loosen your stools. All right. So the basic steps that you do to do that are, number one, drink about 6 to 8 ounce glasses of water a day. So make your stools looser by putting water in. Okay. Number two, having a lot of fiber. All right. So fiber can be in your vegetables, can be in fruit, can be in beans and legumes, but increasing fiber intake can help do that. You can do that through your diet. Okay. And if that's not doing well enough, then you can take magnesium. Magnesium is another way of doing that as well, too. But those are the steps that I usually wind up doing. So make sure you're taking plenty of fiber, basically. And so, for instance, people that tend to have more vegetable or plant-based diets are getting lots of fiber through their diet, tend not to have this problem. But if you start moving more towards animal products, you're going to tend to have more constipation or more problems with this, all right? Now, I want to make sure that you talk this over with your doctor, though, because if you've got blood down there, somebody needs to evaluate you and make sure that you're not talking a hidden cancer in there, for instance. So make sure you're talking with them, too, about that. Okay? All right. Good luck to you, Jim. Hello, Michael. Dear Dr. Marty, thank you for sharing your knowledge with us. We are so lucky to have you. Thank you. 2 questions. 1, I noticed some Lyme literate practitioners encourage the use of DHEA, while one prominent LLMD says it is absolutely not advisable as it will prevent the body from making its own supply. What is your view on this? Do you use DHEA in your practice? So I don't use a lot of DHEA in my practice, but I'm not opposed to using it if somebody has low documented levels of it. Okay. So if you do a DHEA blood test and you have, it's extremely low, I would supplement it. I would use DHEA to make up for what your body is not making on its own. Now, a lot of the reasons I don't supplement DHEA is my approach is to actually do things to support the adrenal glands. So they'll make enough cortisol and they'll make enough DHEA on their own. And so what I like using is the herb called ashwagandha that has been used for centuries in Ayurvedic and Chinese medicine because it's been shown to give people better energy. And the way it works is it helps your adrenal glands work better. We know from animal studies that when animals are on ashwagandha, there's a better production of all of the hormones that are made by the adrenal glands, including cortisol and including DHEA. So usually I'll have people, as part of my approach to managing Lyme, I'll have them do ashwagandha. It's a 400 milligram pill. The company I use is a company called Organic India. And their pills are 400 milligrams. And I'll have people take 2 pills in the morning and then another 2 pills between 1 and 2. And even if they initially tested low on DHEA, often that's going to be enough to correct and get the adrenals to start making DHEA naturally on their own. Okay? All right. All right. Number 2, any thoughts on the use of thymus extract in the treatment of Lyme disease? So thymus, everyone, is an organ that sits here in your chest. and it makes a number of things that support the immune system. One of the big proteins it makes is a protein called thymocycline protein A. And thymocycline protein A actually causes your immune system to make cells that fight virus infections and that can help fight Lyme, okay? In terms of using thymus extract, I haven't seen much benefit. There are times, though, that I will use the thymic protein A, which is sold as a product called ProBoost, and I will use that in two situations. Number one, it has good benefit and has got some science behind it showing that if you take these packets of thymus protein A at the very outset of a viral infection, you can shorten the course of the virus infection and keep it from getting building to anything significant, okay? So for that situation, I usually have people take a ProBoost packet, you open it up, you pour the powder under your tongue, and you let it sit there. And I'll have them do a packet about every 2 hours, 3 times a day on the first day of an infection. And the second day, I'll have them take 1 packet under their tongue 3 times a day on that second day. And then you don't do it from that point on. And that has great benefit at shortening the course of viral illnesses. The other time that I will incorporate thymic protein A into my treatments is if I've got somebody that I'm trying to treat chronic virus infections. I usually will use, in those situations, I'll use olive leaf extract as my virus killer, and I'll start a person at 500 milligrams 3 times a day, and gradually, as their Herxheimer reactions tolerate, I'll have them increase that up to 1,500 milligrams 3 times a day. Okay, so olive leaf extract kills viruses. And then to support the immune system, to turn on the immune system to fight those viruses, I'll do 2 things. One is reishi mushrooms. Reishi mushrooms are shown to increase, turn on the white blood cells production of cells that fight virus infections and even Lyme. And that reishi is 400 milligrams 3 times a day. And if I've got somebody that's really struggling getting their viruses under control, I will add in at least 1 packet of ProBoost a day as well, too. Okay, that's how I tend to work with the thymus gland. Okay, all right. Thanks for your question, Michael, and good luck to you. Hello, Dave. Let's see. I noticed that on your website you sell a product called Super Lipoic Acid by Genester Brands. This product contains alpha lipoic acid. Would you recommend this product to some of your Lyme patients? I have heard that alpha lipoic acid can help with nerve repair and to help remove mercury in the body. Do you think this is true? Also, can you go over how alpha lipoic acid would compare to R-lipoic acid? Which do you think is better to take? I also want to thank you for all the great supplements that you sell on your website and the very fast shipping that you provide. Well, thank you. About the shipping. All right. So, I mean, we're in the pandemic, right? We're still in the pandemic, but I got to tell you, I've been very impressed with my shipping center. So I use a fulfillment service down in Austin, Texas called Smart Mail Austin. And I found them a couple of years ago. And I got to tell you, I have just been thrilled with them. They do a great job. Basically, any order that comes in by 2 p.m. Central Standard Time, their commitment is to get it shipped and out the door the same day. And they do. They actually do. And they have, because they are a large mover of mail, they have a special arrangement with the U.S. Postal Service that when their truck gets over to the USPS in Austin, their stuff goes to the front of the line. So they actually, I mean, and so now, so it's great. It gets to their facility fast. Now, sometimes I can't control what USPS does once it gets there because, as you know, during the pandemic and out of the pandemic, we've had trouble. But boy, in general, it's just been a great service. And so thank you for saying that. And I do get that comment often from customers that use my store. So thank you. I'm really pleased with them as a group of people down there too. Okay, so back to your question. So so lipoic acid, whether it is the DL alpha lipoic acid or the R lipoic acid, frankly, I don't see a difference in how they work. Okay, But alpha lipoic acid is an antioxidant, and it is used to promote the production in the body of glutathione. Okay, so every one of your cells makes a very powerful antioxidant called glutathione. And glutathione is the master reparative antioxidant that is made in every one of our cells. As a strong antioxidant, it also helps lower oxidizing agents that can trigger your white blood cells to make cytokines. So glutathione also helps lower cytokines, and I talked about those cytokines earlier tonight. And glutathione also is the main detox chemical that is used by the liver to remove toxins, okay? So my preference is, instead of using the alpha lipoic acid, is to actually just give glutathione. I think it does you get a more effective job at raising glutathione levels, all right? And so for that, I like using a product called Trifortify, either orange or Trifortify watermelon, made by a company called Research Nutritionals. And that is 1 teaspoon 1 time a day. It's a liposomal product, so it's glutathione that's microscopically wrapped in fat to increase the absorption. And they've got great studies done showing that actually it does increase absorption, and you get really good levels of glutathione. Right. So raising glutathione is what can help repair nerve injury. All right. And glutathione, as a strong antioxidant, also binds up heavy metals. All right. So the times I will use alpha lipoic acid, or I will use another antioxidant that's a building block for glutathione called N-acetylcysteine. I will sometimes use those when I've got a person that cannot tolerate taking glutathione. All right. My preference, though, is to give glutathione. But the 2 antioxidants that actually promote glutathione production would be an alpha lipoic acid or an R-lipoic acid, and also N-acetylcysteine. The dosing that you can use on an alpha lipoic acid or an R-lipoic acid is to dose about 200 milligrams 3 times a day, or the super lipoic acid is a 350 milligram product, and you would do 1 pill twice a day on that. N-acetylcysteine, I have a Thorne product for that I really like, and that's a 500 milligram pill, and I have people dose that as 500 milligrams twice a day. Okay, so if somebody can't tolerate oral glutathione, then my backup plan is to have them do lipoic acid, like this super lipoic acid, twice a day, and then I'll have them do N-acetylcysteine 500 milligrams twice a day to promote cells producing their own glutathione. Okay, all right. So why do you even need to give glutathione? Well, if your cells make it on its own, let's just talk about that real quick. So if your cells are under stress or they're injured, they will eventually exhaust their own glutathione supply trying to fix themselves. All right. So you can kind of think of using glutathione as a means of filling up the gas tank again. Okay. All right. Good luck to you, Dave. Oh, that Trifortify product is a product by Research Nutritionals, by the way. All right. Let me see. Did I answer all your questions? Yep, I did answer all your questions. Great. Thanks, Dave. Good luck to you. Hello, Ritu. Let's see. Are all thyroid medications by prescription only, as in desiccated thyroid? The answer is yes. Desiccated thyroid and Synthroid and T3 thyroid, all of those are by prescription. Okay. Now, there's another thing I will do is sometimes if I've got somebody that has low thyroid, sometimes my first approach is not to actually give thyroid medication. I will do things to support the thyroid. One of those is the ashwagandha that I mentioned earlier, and that would be to take a total of 800 milligrams in the morning, 800 milligrams between 1 and 2. Other nutrients that can help the thyroid to start working better is selenium, 200 micrograms a day, a vitamin D, about 5,000 international units a day. Iodine, about 100 micrograms a day. And selenium, about 200 micrograms a day. those are nutrients that are very helpful at helping the thyroid work well too. Okay, you can just find those in a good multivitamin like Physicians Daily multivitamin by Research Nutritionals has those substances in it, for instance. Okay, all right. So I think it does. Let's go look at that one together here real quick. All right, so let's go look at, it's called Physicians Daily. All right, so Physicians Daily has in it 150 micrograms of iodine. It's got zinc in it also, and 26 micrograms, which is a nutrient that helps your thyroid. It's got selenium in it at 60 micrograms, which is a nutrient that helps your thyroid work. And I believe this has vitamin D3. Yeah, it's got some vitamin D3. This is 2,000 international units. It's got that in it as well too. So this would have the nutrients in it that will help your adrenals or your thyroid work better. And in addition, I would suggest using the ashwagandha that I mentioned earlier. Okay, so in terms of that ashwagandha, this is the ashwagandha product that I was mentioning earlier too. Okay, all right. And then I'm just going to do another screen share. So I have written a very detailed, almost too detailed article about thyroid, and where I mentioned these key nutrients as well too. And that's this article here called Hypothyroidism, the Best Test, Meds, and Vitamins. So you'll find that information here as well. Okay. All right. Good luck to you, Ritu. Margaret says hello. Hello, Margaret. All right. This is from Michael. Dear Dr. Marty, can I safely take lubrikinase alongside herbal medicines for Lyme, which have blood thinning properties such as Japanese knotweed, cat's claw, and endographis? Yes, you can. I haven't seen any increased problem with that. So no, there's no problem doing those at all. Okay. All right. Very good. Good luck to you, Michael. Hello, Adasha. Let's see. I have been fighting Lyme for 2 years now. Struck down with mold, penicillium. Not sure where it came from. What are the best foods to eat to detox this? I can't eat much, so I need the superfoods. So basically, so let's talk about mold toxicity, and then I'll describe what you might consider doing. So, so when you have mold toxicity illness, it means that mold toxins are trapped in you, okay? And what's supposed to happen in 75% of us is we breathe in mold toxins from the world around us. They get into our lungs, and then they get absorbed into our bloodstream, and then those toxins are in the bloodstream, all right? And in 75% of us, what happens is some of our white blood cells will see those mold toxins and tag them, and then other white blood cells will come in and break those mold toxins down, and they never bother us at all, okay? But what happens in 25% of people is our white blood cells don't see those mold toxins, and they don't tag them. And because they don't get tagged, the other part of the white blood cells don't come in and break them down. So then the next line of defense is they go to the liver, and the liver is supposed to take what are fat-soluble toxins, like a mold toxin. The liver is supposed to apply a bunch of chemical groups to them to make them water-soluble. And then if the liver did do that, they would move out into the intestines, and being water soluble, they would mix in our poop and we'd poop them out. However, the liver isn't able to take mold toxins and transform them into water soluble toxins. So they go to the liver, they come out of the liver still moves them out into the intestines, but out in the intestines, they're fat soluble, okay? And things that are fat soluble get reabsorbed right back into the bloodstream. So you got mold toxins in your bloodstream, they go to the liver, get moved out into the intestines, and then they get reabsorbed right back into your bloodstream again. And you just get this endless loop of toxins circulating around. Now, what those toxins do is they trigger inflammation. They trigger your white blood cells to make those cytokines that I mentioned earlier that give you all these nasty symptoms, okay? So one thing you can do is make sure you're doing something to lower cytokines. And one of the things I like to use to lower cytokines is curcumin. Curcumin, which comes from the Indian seasoning turmeric, is not well absorbed. So you usually want to have a supplement that is prepared in a way to increase absorption. The product I like for that is a product made by Thorne called Bariva 500. And you would do 1 pill 3 times a day of that, okay? All right. Now, the other thing you want to do is be on a fibrous compound that will absorb those mold toxins, okay? And the way you could do it with foods, you would want to use soluble fibers. So you could Google up a list of, just Google soluble fiber and see what foods show up. So for instance, apples have soluble fiber in them, which apples are rich in pectin. Foods that are rich in pectin are soluble fiber. Avocado is soluble fiber. And you could emphasize in your diet foods that are rich in soluble fiber, and they could potentially bind that up, okay? Other things you could do if you don't want to do it with food is you can take supplements that are rich in fiber and also rich in clay and charcoal, all right? And one of those would be something called a GI detox. And you could do 1 or 2 pills 1 time a day to actually absorb up the toxins in the intestines as well too, all right? So those are some things to think about, okay? All right, good luck to you. Hello, Eileen. Let's see. Thank you so much for doing these. You're welcome. Let's see. I had a DVT after a long drive and probably an early case of COVID before they had test. I have a 54 on anti-cardiolipin antibodies. Hold on. I got to put my glasses on just to read this. The IgA, let's see, IgM, I am positive. IgA and IgG and IgA were both under 9, considered negative on the test. The docs say I have anti-cardiolipin syndrome. Do you agree? Also, my research has said that anti-cardiolipin syndrome can be caused by Lyme. Have you seen this? Do you think resolving my Lyme and BART will take care of the anti-cardiolipin syndrome? I'm using your herbal protocols. Thanks again, Eileen. All right, so anti-cardiolipin syndrome is an autoimmune illness, and autoimmune illnesses can be triggered by Lyme. That doesn't mean all of them are, okay? But it is possible that if you treat your Lyme and you have anti-cardiolipin syndrome, it is possible as you get Lyme under control that the anti-cardiolipin syndrome will resolve as well too. Okay, it's possible. Okay, I can't guarantee it will, but it's possible. Okay. Now, as to whether I agree that you have it, hold on here a minute. Yeah, you know, again, I'm not your physician. I don't get to examine you. I haven't been able to look at all the other blood testing that's been done. But just on what you presented here, yes, I would agree with that as a concern for you, that there is anti-cardiolipin syndrome going on here, okay? But again, this is just based on a limited snapshot of what you just told me there. But to answer the bigger part of your question is, could it be triggered by Lyme? Yeah, it could be. And it could resolve as you get Lyme and co-infections under control, okay? All right. Good luck to you, Eileen. Hello, Robert. Let's see, Dr. Ross. I've been taking resveratrol and 250 milligram caps of Japanese knotweed root extract. What will a comparable amount be for the tincture, and does it have better absorption? Gosh, I don't know off the top of my head. I would have to look that up. That's one I don't know on the top of my head, because generally I don't have people take resveratrol capsules. I just use my Japanese knotweed tincture. And for knotweed tincture, what I like using is I follow Buhner's recommendations, which is to start at a quarter teaspoon 3 times a day and even work up to a half a teaspoon 3 times a day. I'm using dosing in that kind of range in terms of my treatments. But, knotweed, I'm using it because in addition to being anti-cytokine, it also can be effective at killing things. It can be effective at killing a Lyme. It can help with persister Bartonella. And so I like using it for those purposes as well, too. But I don't know how to convert the 250 milligram capsule into what is in the liquid tincture. I don't know that off the top of my head. Okay. All right. Good luck to you, Robert. Hello, Mildred. Let's see. Have you used BPC 157 as a transdermal cream? Does it really have any effectiveness without being injected as it is normally is by bodybuilders? So I don't have any experience using it as a cream. I do have experience using it as a pill, actually, as an oral pill, and am finding some good benefits with my patients in terms of helping with aches and pains, nerve repair, better energy. And some of my patients seem to be having better functioning immune systems as I've been using it. And that's in an oral form. I actually haven't used it in the injectable forms either. I've just used it as a pill. All right. All right. Good. Good luck to you, Mildred. So Mildred, if you're looking for it in a pill form, let me just show that to you real quick. So there is a company called, wrong page here. There's a company called Integrative Peptides that is manufacturing a number of the peptide therapeutics. And right now they have available 4. One of those is body protection compound, something called Can't Wait Cerebrapep, which is a peptide of cerebrolysine, which can help with thinking. TB4 frag, which is a thymosin peptide that can help improve thymus gland function and your immune system function. And then this BPC 157, okay? The dosing on this pill of BPC 157 is 1 pill twice a day. And for those of you that are new to BPC 157, if you're looking at what it might do, take a look at my description of it right here, where I talk about the kind of things that it might help with. Okay. So I said tissue repair. And what I mean by tissue repair is it can help joint pains, muscle pains, and even nerve and nerve function as well too. Okay. All right. All right. Thanks for that question, Mildred. Good luck to you. Hello, Thomas. Let's see. Have you ever seen lipodystrophy or where the blue veins are very visible now because it's like a subcutaneous level of fat is no longer there? Also, the indentations on the temples and the forehead are very prominent now. So, Thomas, I think you may have asked me a similar question last week. I haven't seen something like that before. So I'm sorry, I don't have any good recommendations on that. All right. I don't know how to approach it off the top of my head. I'll put it that way. Hello, TJ. Can Lyme lower IgG and its subclass production? I don't know that. I don't know. I haven't looked at the literature on that before. I know that so the question is the chicken or the egg, right? What came first? Does Lyme lower the IgG subclass, the immunoglobulin antibody subclass, or does a person have low immunoglobulin subclasses that makes it harder to get over the Lyme? I will, if somebody has markedly low IgGs, I will recommend they get IV Ig, where it's basically injected. They can build up the levels that way. But I'm not sure that Lyme causes it to be low. I haven't seen the literature. I haven't looked at the literature on that to know either way. Okay. All right. Good luck to you, TJ. Hello, Brandy. Let's see. What would cause the hair to thin on the lower shins or even stop growing around the ankles? When I look at hair loss anywhere in the body, it can be up here, it can be on the skin. Two essential things I like to check to begin with is I like to look at thyroid levels. I like to do thyroid blood testing. I also like to measure iron or something, the storage form of iron in the blood called ferritin. Both low iron and low thyroid are recognized as things that can lead to hair loss. Okay, so I would want to look at those first. Okay, if those are normal, then the next thing I like to try to do is to supplement biotin, which is a B vitamin that has been shown to be useful to help hair and nails. Okay, so that tends to be what I'd like to do with that. Okay, all right. Good luck to you, Brandy. Oh, I thought that was right. Okay. Hi, Garner. I couldn't tell whether that was an M or an R and an N. Let's see. Can you talk about some of the upper end? Hold on here a minute. Let's see. Can you talk about some of the upper end dosages used on your most preferred herbs, and has there been benefit? There's a person in our Lyme support group who said that she got tremendous benefit from Banderol, but at triple the recommended dose, which of course you're not going to find in any literature anywhere. So the doses I recommend in my protocols are all ones that I have found useful for people. Number one, they tend to be consistent with the dosing recommended either in like for the Otoba, it's a dosing similar to what is recommended in Cowden, the Cowden protocol. And the non-Cowden protocol herbs, I tend to dose in similar fashion to the way that Buhner might do them, as in Buhner herbs. Where I may get a little bit more aggressive is my use of Cryptolepis, where I have people take 5 milliliters 3 times a day, because I just find it a much better benefit in dealing with Babesia, actually, than lower doses of it. Now, ultimately, what is effective is what works in a person, as long as the dose you're taking doesn't give you any toxicity, right? So it's possible this person benefited by using triple doses. I would be concerned if they might start getting side effects of those doses, although at lower doses, I tend not to find much in the way of Banderol side effects. But so, yeah, those are my general comments on that. Okay. All right. Good luck to you. Hello, Carter. Anything for mood or motivation? I feel like I've become a mindless robot where I just eat and sleep, but I have no imagination or creativity or mojo, no gusto or confidence or cockiness. It's like my brain or my liver just stopped producing any variable hormones and just went into an awakened coma. So, Carter, the first thing I would want to do is to ask you a bunch of questions to try to figure out, is there a degree of depression that you might be having? Okay, now I want to be very clear. I know a lot of people with Lyme disease and mold toxicity have been told they're crazy because doctors, find it easier to say it's all in your head than to look at underlying causes. Okay, but as part of Lyme disease and as part of mold toxicity illness it is possible to develop depression, okay? That's not to say the whole illness is depression, but it is possible to have depression. And a key symptom of depression is lack of motivation, losing interest in doing things and just not feeling to get up and go to do it, okay? So I would probably want to spend time with you trying to figure out, by asking a bunch of questions, is there some depression going on here? That is something, though, that you might want to take up with your Lyme doctor or your primary care doctor and see if they would help you explore as to whether that might be what's going on with you, okay? All right. Good luck to you. Hello, Mosby. Let's see. Looks like somebody already mentioned things about mood, but I had a question about Endodynia. I'm not fazed by anything. It's like I'm just numb. I feel like I don't laugh or cry anymore. Is it possible to recover from this blindness, or is this just permanent brain damage from loss of white and gray matter? So Mosby, I think you asked somebody, it may have been you, asked something similar to this last week. And for this kind of situation, I suggested you might want to talk to a psychiatrist to have them explore possible medications for you. It is possible this is part of depression, but it may be a separate situation altogether. But I think you need to have a professional that can sit down and explore with you what's going on, look at medications, and maybe even do MRI imaging if needed. But you need to have somebody help you take a look at that, okay? All right. Good luck to you. In my experience with the Endodynia is sometimes I see that in Barton a lot. Sometimes I see it in Lyme. I have had improvements in it in some of my patients just by treating those infections, but not in everyone, okay? And often when it's severe, I will get psychiatry involved to help you with that, okay? All right. Hello, Adosh. Let's see, I've been treating Lyme for 2 years, but now have toxic. Oops, we talked about that earlier. Let's see, it might have been, you may have written it twice to me, so let me get that off there. Hello, Matt from Houston. Let's see, when we are taking the herb protocol, how long do the herbs last before they lose their strength? So first of all, if you're asking how long will these herbs last in a bottle if you haven't opened it, that could be a year, 2 years. I mean, the liquid tinctures are all alcohol-based tinctures. The alcohol acts as a preservative, okay? And so you have no problem with them losing their potency in terms of that's what you mean by this question. If you mean how long will they be effective in terms of helping to kill germs, basically, I find that the herbal approach can last a year, maybe even longer. And so I make a decision in terms of how long to leave somebody on an Otoba and a cat's claw, for instance, tincture, based on the response. If we're at 6 months and they're still improving, I'll continue it. If we're at a year and somebody's on these tinctures and they're still improving, I will continue it. So I tend to find they can keep being effective for quite some time. Okay. All right. Good luck to you, Matt. Hello, Margaret Lee. Let's see. Can you give more information on peptide therapy and when it's appropriate to incorporate? Thank you. Margaret, that's a whole topic. I'm going to give you just a brief outline of what I'm doing right now. And my outline is based on what has available to me, which are the integrated peptide products I was telling you earlier. So I start my peptide therapies with BPC 157. I consider that to be the foundation approach. And that is because the BPC 157, everyone, is a peptide that is made naturally in the stomach lining. And in the stomach, it is released to help repair intestinal injury. So, but it has been also observed that it is effective at helping with muscle and tendon injury repair, joint repair, and neurologic function repair. It has some ability to help your mitochondria energy factories work better. and there is some relationship to helping balance your immune system so it might more effectively fight Lyme and co-infections, for instance, okay? So usually I will start with that, and I'll have people take 1 pill twice a day. If they're tolerating it, they may even go up to 2 pills twice a day, and that's where I'm going to start, okay? Now, if I've got somebody that is having a lot of thinking problems as part of their illness, I might add in the cerebroprep, also known as cerebrolysine, which is a peptide that can help with thinking. And for that one, I'll have a person do 1 pill a day on that, okay? And that would be, and I usually will get them first on the BPC 157, and after a month of being on that, either at 1 or 2 pills twice a day, then if their thinking hasn't improved, then I might come back in and add the cerebrolysine. I'll start at 1 pill a day. In a month, I might even go up to 2 pills a day on that, okay? All right, now, if I've got somebody that is having a lot of immune dysfunction and putting them on BPC 157 has not made a difference after a month or two, then I might come back and add in the TB4 Frag Plus product that I showed you earlier. And I would do that at 1 pill twice a day. And that's where I would start with that. In terms of the other peptides that you have to get as injectables, I am not doing them. Part of the reason I'm not doing them is that the FDA has been cracking down and making it harder and harder for people to get supplies of them. And I think that is what's going to keep happening. And so I don't want to put people on something that I can't get my hands on anymore. I think that eventually the FDA is going to take away the ability for most of the injectable peptides to be manufactured by the compounding pharmacies that are making them, unfortunately. All right. All right. Thanks for that question. And good luck to you. Hello, Athena. Let's see. Thank you, Dr. Ross, for your wonderful contributions to the community. Could you please speak to the non-antibiotic treatments for Borrelia and Bartonella for those patients unable to tolerate long-term antibiotics? Sure. So I'm going to talk about the things I start with, okay? So for Borrelia, for the Lyme germ, I like working with 2 herbal antibiotics to start, and that is cat's claw and otoba bark, okay? Now, how I got the idea to work with those is based on research that was published probably about 10 years ago now by a researcher out in New Haven, Connecticut named Eva Choppy and her Lyme disease research lab. And they were able to show on Petri dish experiments that that the cat's claw as well as the otoba individually, each of those did a great job of killing spirochete and cyst Lyme. Those are the 2 ways that the Lyme germ looks, okay? In addition, both of these herbs individually did a good job of removing biofilm slime layers that can cover the germs too. But when you put the 2 together, there was a whopping kill. There was a bigger kill than you would even expect by just adding their effects together, okay? An added effect and a whopping effect at removing biofilms, but also at killing the germs, okay? So based on those Petri dish studies, I started introducing these 2 herbs into my practice about 10 years ago, and they've become one of my go-to treatments. I find they work about 85 to 90% of the time, all right? They are also found in the Cowden protocol, but Cowden would have you rotate on and off of them about every 2 months. I just have people stay on them permanent for long term, month on month on month. And they work great, okay? More recent studies that have come out of Johns Hopkins University shows that the cat's claw is also effective at treating persister Lyme, all right? So the Lyme germ, let me just do a quick rundown of all these terms I'm using for Lyme. Lyme has 2 appearances. It looks like a corkscrew, that's the spirochete, and that corkscrew can morph into these little round structures that don't even have a cell wall on them called cyst, okay? Those are also called round body, cyst, and L forms. They all go by the same name, okay? But essentially there's 2 ways that the germ looks, okay? These 2 forms are in a growing state, all right? And that's the majority of Lyme germ is in a growing state, okay? These can morph into a non-growing state and become what are known as persisters, all right? And these persisters are basically hibernating forms of the germs that seem to ignore antibiotics that we throw at them. And but if you wake up the germs, they'll start responding to those antibiotics, okay? So I'd like to also put people on things that deal with the persisters. And fortunately, the cat's claw does that, okay? So the way I would start the Otoba and the cat's claw is I'd have a person start at 5 drops twice a day, add 1 drop per dose each day, and work up to 30 drops twice a day. If you get a Herxheimer reaction on that, don't increase until it passes, all right? After a person has been on that for about a month and they're stable, I'd like to add in liposomal cinnamon, clove, and oregano capsules by a company called Dr. Inspired Formulations. Those oils have been shown to be very effective at treating persister and growing forms of Lyme, and also growing and persister forms of Bartonella, okay? All right, now, for the Bartonella specific herbs, I like to use Siddha acuta and Hutania, all right? And those I also work up to 30 drops twice a day, start them the same way I do the Otoba and cat's claw, all right? And so often, if I've got somebody that has Lyme and Bartonella, at the same time, I'll have them start all 4 tinctures of Siddha acuta, Hutania, cat's claw, and Otoba, put them all in the same glass of water, put the drops in and drink it all at the same time. And you work up to 30 drops twice a day. After you're on that for a month, then I have people start the liposomal cinnamon, clove, oregano, and I'm doing that to mainly go more strongly at these hibernating persister forms of Bartonella and of Lyme. Okay, all right. So, yeah, and I most people can tolerate these just fine. Okay, if you're looking for a source for those herbs, take a look at. Let me just show you real quick here. All right, so what I just recommended to you is something you can find in my Lyme support protocol. And the specific herbs I just mentioned, here's the Siddha acuta, here's the Hutania, here is the cat's claw, and there's your Otoba bark, okay? So take a look at all of those, and that's where you're going to find them, basically, okay? In terms of the liposomal cinnamon, clove, and oregano, this is that product right here, the liposomal cinnamon, clove, and oregano, okay? Now, in terms of this protocol, if you actually want to see what my Lyme treatment protocol is, this is my Lyme disease information site, Treat Lyme by Marty Ross MD. Click on my Lyme protocol page here, and you can use this navigation menu over here. But for the Lyme infection, I talk about specifically about the Otoba bark and the cat's claw and the liposomal cinnamon, clove, oregano combination there. For the Bartonella, I talk about the Hutania, Siddha acuta, and the cinnamon clove here. Okay, now the Siddha acuta, I just told you can work up to 30 drops twice a day. Alternatively, if you want to go stronger, you can look at doing it as a 1/4 teaspoon 3 times a day for a week, then going up to 1/2 teaspoon 3 times a day. But I have to be honest with you, I find effectiveness of it at 30 drops twice a day as well too. Okay, all right. All right. Thanks for that question, Athena. Good luck to you. Hello, Julia. Let's see. Hi, Dr. Ross. Is it normal for Lyme mold to cause you to be more susceptible to injury? I have an impingement in my shoulder due to rotator cuff injury, cubital tunnel syndrome, and now my neck has been hurting because I've been looking down. All of these are due to posture issues. However, I didn't have the best posture before I got sick and never had any of these issues, and it feels harder to heal than the average person. So, Julia, my observation is when you have Lyme and co-infections, you just have a lot more inflammation in the body to begin with. And that is because of those cytokines I mentioned earlier tonight. So your immune system is overproducing cytokines, and those cytokines trigger those, are inflammatory, and therefore all of your tissues are going to tend to be more inflamed, okay? Secondly, what promotes healing when you have injuries is your immune system, and these cytokines can suppress the immune system too. So yeah, some people with Lyme tend to have a harder time recovering and tend to get injured more easily because they already have extra inflammation to begin with. And then these cytokines suppress your immune system and its ability to heal as well too, okay? So as I mentioned earlier tonight, my go-to that I like to use to help get cytokines under control is that Thorne Mariva 500, and that's one pill 3 times a day. It's a curcumin product, a liposomal curcumin product that's microscopically wrapped in fat to increase absorption of the curcumin. Okay, all right. Good luck to you, Julia. Hello, Sharon. Was FMT effective when you used to use it? It was their unexpected benefit beyond ulcerative colitis. So, Sharon, you may have asked a similar question last week. I did respond to an FMT question last week where I talked about FMT and what I found it to be useful for in my practice. I'm going to direct you to listen to last week's webinar where I covered FMT, fecal microbiota transplant. Take a look at that video to see what I said. Okay? All right. Hello, Justin. Do you like prolotherapy, prolozone for joint damage, or do I accept permanent damage? So, everyone, prolotherapy or prolozone therapy is basically, I think you're using ozone for it. So basically with prolotherapy, you inject something into an injured tissue that leads to more inflammation, which can promote healing, okay? And ozone, which is a strong oxidizing agent injected into tissues, would lead to some more injury because it's an oxidation agent that then turns around and promotes healing. Could it be helpful? Yeah, it might. It might if you're going to use it for that purposes, okay? In terms of ozone as a germ killer, I think many of you know I don't support it because the science says it probably doesn't work well when you inject ozone into a person. And the reason ozone doesn't work well in a living person is that we're full of antioxidants that neutralize its killing effects on germs, okay? There's actually been Petri dish experiments looking at that, all right? The other thing, Justin, you might want to look at as a means of helping joint injury is the BPC 157. I've had a number of my patients that are just having really good benefit with prolonged joint pains and joint issues when they get on that BPC 157 at 1 pill twice a day. Again, that's the peptide therapy. Okay? All right. Good luck to you, Justin. Hello, Dave. Let's see. Hello, Dr. Ross. My wife was diagnosed with Lyme, Bartonella, and Babesia 4 years ago. I recently tested positive for all 3 as well. I have never been bitten by a tick, nor do I hike or do any outdoor activities. I have lived in Los Angeles my entire life. Is it possible that my wife passed it to me via sexual intercourse? I keep getting conflicting answers from numerous doctors. Thank you. So in terms of whether these germs can be sexually transmitted, what I would let you know is we have no scientific proof that they are. There has never been an adequate study that shows that Lyme, Bartonella, or Babesia can be sexually transmitted. Having said that, I think it is possible they could be, but I have no proof that they are, okay? So why do I think it's possible? Well, if we look at, there have been some studies done looking at the male ejaculate and the female vaginal fluid in women that have Lyme and in men that have Lyme. I'm just speaking about the Lyme germ now. And what we see in men and women that have Lyme is that about 50, one study looked at, is it in the ejaculate and in the vaginal fluid? That one study showed that 50% of the time that a man has it, it's in his ejaculate, and 100% of the time that a female has it, it's in her vaginal fluid, okay? Now, there was another study done that repeated the same thing, and in that study, 100% of the time that a man has it, it's in his ejaculate, and 50% of the time that it's in a woman's vaginal fluid, all right? So it's in your sexual fluids. That's what those studies tell us, all right? There was another study done that you might find if you Google hard enough on this one that was a really crap study. I'm just going to start by saying that. And it was a study that was authored by Stricker, and I think Middleby may have been part of that, but Stricker out of San Francisco. And it was a study looking at 13 people, all right? Now, in medicine, any study that only looks at 13 people is, who knows if it can be reproduced to everyone in general, okay? So first of all right? But what they did in this study is they took men and women and they swabbed the male ejaculate and they swabbed the female's vaginal fluid of these 13 people and were able to determine what strain of Lyme was in the vaginal fluid and what specific strain of Lyme was in the male ejaculate. Now, in the 13 people studied, there were actually 3 couples. So 6 people made up these 3 couples, okay? And in each of the couples, the male and the female had identical strains of Lyme. And so the authors concluded, gosh, that must mean it's sexually transmitted, okay? But here's the problem. When you're measuring what's in a woman's vaginal fluid, it's either because she has Lyme in her blood that leaked into the vaginal fluid, and so therefore the strain that's in the vaginal fluid really represents what's in her blood, okay? Or if it's in the female's vaginal fluid, it could have been made as a deposit from her male partner when he ejaculated, and what you're really measuring is just remnants of the male ejaculate that might not ever actually get absorbed into the female because the vaginal fluid is full of all kinds of defenses that can keep things that get into it from getting absorbed into the bloodstream, okay? And in the study that they did, they didn't control for the last time the male ejaculated in the female. So when they measure something in the female's vaginal fluid, I don't know that it represents her strain of Lyme, or is it really her partner's strain of Lyme that he just deposited in her sometime in the last 3 days? Okay, we have no way of knowing. Plus, again, it was a study only involving 13 people, so who knows if that's valid, okay? Now, in my practice, I tend to see a large number of partners that have it, larger than I might think would be natural to occur. So it has me questioning, could Lyme be transmitted, okay? On the Bartonella front, I think there is a limited chance that Bartonella can get through because I have seen 2 people have it that are partners. Okay, I mean, I've seen 2. By that, I mean not in my whole practice, the whole time 2 people, I mean a couple, 1 and 2, okay? I've seen both partners have Bartonella, and I have to question if it was sexually transmitted, but I don't know for sure. So the answer is, I don't know, all right? The other thing you have to be careful of is if you were tested just because somebody felt like testing you and you have no symptoms of Lyme, Bartonella, or Babesia, there is a great chance that it could be false positive. So there is a concept in testing that we call positive predictive value, which means if a test comes back positive, does it accurately predict that you actually have the illness, okay? And the positive predictive value of a test goes up with the increased amount of symptoms you have of that illness, all right? So for instance, if you test positive for Lyme but have absolutely great energy, your brain works well, no sleep disturbances, no body pain at all, the chances are that's a false positive test. Okay, so just keep that in mind as you're trying to figure out this one out too. But to fully answer your question, there's no proof. It might be, might not be. All right, sorry about that. I wish I had something better to tell you. Okay, all right, good luck to you. Hello, Phil. Let's see. Hi, Dr. Ross. Let's see. I had COVID during the month of January and received IV monoclonal antibody treatment. I have been experiencing significant post-COVID symptoms that are not responding to current treatments. And that is liposomal curcumin, quercetin, glutathione, Trifortify, vitamin C, hydroxychloroquine injections. The post-COVID symptoms are hair loss, severe fatigue, burning painful joints, what appears to be metabolic changes with weight gain, etc. I was diagnosed with CVID several years ago and have been through successful treatment for Lyme, Bartonella, Babesia, Ehrlichia, toxic mold. I would describe what I'm feeling as a severe cytokine storm based on past experience. What additional treatment suggestions would you make to stop the production of cytokines? Oh, boy, that's a good question. So first of all, let me just tell you what may be going on that could be triggering this. There is some science, and again, we're still really trying to understand what post-COVID syndrome is that leads to this problem in people, okay? But there is some science to suggest that one of the problems is that the immune system, especially a type of cell called monocytes, may have a hard time breaking down the spike protein that they try to attack, and that this spike protein gets lodged in these monocytes, and so it causes them to keep overproducing the cytokines. Okay. What is also true is that when I've seen this happen in patients is that sometimes it's just a matter of months, unfortunately, even 6 months or longer before people start to recover, because eventually the monocytes will clear the spike protein. In terms of what I recommend people do to help lower cytokines, you're doing all of it already. So, I mean, the liposomal curcumin, you could try to increase that up to 1,000 milligrams 3 times a day. All right. It looks like you're on 500 milligrams 3 times a day. You might find better benefit going up to 1,000 milligrams 3 times a day. The quercetin, which can also help lower cytokines, I usually will dose that as 3 times a day, 500 milligrams. So you might want to increase that. The glutathione, you could look at doing a packet of the Trifortify actually 2 times a day. Okay. Those would be the main things I would do. I would try to adjust up the amount of anti-cytokine work that you're doing, basically. Okay. All right. And it's a nasty thing to have this happen. I know. So good luck to you with that. Let me make sure I answered. Yeah, those are the adjustments I would make. And what I have found in my practice is it's just a matter of time, unfortunately. It could be months sometimes. I hope you're not locked into it for months. But I have seen one of my patients took about 6 months before she did eventually turn around, and she's doing fine now. She caught it even before we had testing for COVID. We just assumed she had COVID based on her symptoms. Okay. All right. Good luck to you, Phil. Hello, Rezi. Let's see. My 17-year-old daughter has been treated for Lyme with antibiotics since November. She started showing improvement. 2 weeks ago, after glutathione drip, she had an increase in lethargy, always yawning, increased weakness. Do you think we can link it to the glutathione? And how do you feel about using ivermectin to treat Lyme? All right. So I don't agree with using ivermectin to treat Lyme. There is actually no science that shows it is an effective killer for Borrelia. There is some science that shows that it might regulate cytokines. And so if somebody is there are some people that go on it that seem to have some benefit, but I think it's coming from lowering cytokines. I don't think it's an effective Borrelia killer, to be honest with you. Okay. In terms of what could have happened with that glutathione, sometimes when people get glutathione, they do get worse. And yeah, one of the things that can happen, so glutathione is used by the liver to move toxins. All right. And if the liver, if you've had a buildup of toxins in the body and suddenly you give the liver a lot of glutathione, it's like removing the roadblock that has held all these toxins back. And sometimes they will start coming through the detox, and it become that movement of that many toxins can trigger more cytokines to be made, okay? Which is odd, because another benefit of glutathione is that it actually is a very strong antioxidant that lowers oxidizing agents that tell your white blood cells to make cytokines, okay? But I have found for some people, too much glutathione makes them worse. And so the issue is trying to find a level that she can do that won't trigger worsening, all right? That's usually what I recommend for people, okay? All right. Good luck to you and your daughter. Hello, Alexandra. See, hi, Dr. Marty. I did 7 to 8 months of antibiotics for rifampin, azithromycin, and methylene blue, and my Bartonella numbers have remained the same, and my Babesia came down. I am curious as to what could be the culprit. The previous year I was able to bring down my Babesia numbers significantly, 30 points, with just artemisinin. I may have been re-exposed to mold while on the antibiotics. Could this account for my numbers did not budge, or any other reasons, not enough biofilm busters? Now that I am out of mold, I am wondering if I should try antibiotics or just go herbal route for addressing Bartonella and Babesia. Any suggestions? All right, so I'm going to make a comment, and I know it goes against what a lot of my colleagues are doing. There's actually no testing you can do that proves if Bartonella is getting better or Babesia is getting better. I know a number of my colleagues are doing two things. They're either looking at the amount of reactivity on your immunoblots, which is a way we look at antibody levels, or they're looking at your response on an ELISpot or a T-cell activation test, and they're using that as a guide. However, there has been no validation ever done looking at these immune reaction reports to see, does it correspond with the amount of germ load that's in you, okay? So the way that I go about doing this in my practice is there is no valid testing that shows you where you are in a treatment. There just isn't, okay? You have to go by what your symptoms tell you. If your symptoms are a lot better, then you probably took care of it. And again, we just don't have any testing that shows us that. I mean, ultimately what you're worried about is, did you get rid of the germs, all right? And the testing that we have for Bartonella and Lyme and Babesia is all immune reaction testing. It's measuring your immune reaction. And sometimes that immune reaction can say turned on, even when the germs are gone. Sometimes that immune reaction will go away and give you a false hope that the germs are gone, because sometimes the germs suppress your immune system, turning off the reactivity on these immune tests that we do. So Westerblot, Immunoblot, ELISpot, Armin Labs, Infecto Labs, those are all immune testing ways, okay? And they're not a reliable way of telling if you have germ in you or not. My advice to you is look at what your symptoms tell you, okay? All right. Good luck to you. So Alexander writes, just a note, the test I did were Armin ELISpot. Yeah. So the ELISpot, again, they have not been validated to have any relationship with germ load. No one has said, this is how reactive my ELISpot is. And then no one's been able to go in and do studies to say that prove what the germ load actually is. So I don't consider them valid. I look at what the symptoms tell me. Okay. All right. All right, everyone. That's it for me for tonight. So I've enjoyed being here with you, but it's time to go. I've got to get my two snoring Basenji dogs out. They're both snoring under my desk here. So tonight I will work on the videos and try to get them cleaned up, and then create a synopsis to get out to you tomorrow morning. And I'll do some of that work tomorrow morning. Again, when you get that email tomorrow morning, there will be a chance to sign up for the next series of webinars that will be in April. So I will be off for a couple of weeks. One of those is a week where I'm traveling to see my dear old dad in his assisted living facility in Colorado Springs. So maybe I'll run into some of you in Colorado Springs for those of you that are in that area. So anyhow, great being here with you tonight. Tomorrow morning, I'd appreciate it when I send out that email if you would share it with anyone you think would benefit from either signing up for the next series of webinars or for the content that we discussed in the video as well too. Okay? All right. Good night, everyone.